everyone, today we will have a presentation about the impacts of COVID-19 pandemics on healthcare workers related SDG3. Here are our group members, which are Pengyan, Fazeera, Kim, Yong, Yuyan, Duanli, and Xiaoying. The SDG3 ensure healthy life and promotes well-being for all at all age. The abstract discussed that since the outbreaks of COVID-19, all Sustainable Development Goals has been impacted, and due to their interrelated nature, health-related SDG3 has been seriously impacted as well. From the literature reviews, this pandemic suggests that these events have significant short-term and long-term effects on the mental health of healthcare workers, with the most common psychological problems such as fears, depression, anxiety, burnout, post-traumatic stress disorder, and insomnia or sleep disorders. The introduction shows that due to the COVID-19 pandemics, healthcare workers encounter challenges in treating COVID-19 patients and also their regular duties. Hence, they suffer from the psychological illness and it may cause a serious issue. Therefore, the objective are studying the impacts of COVID-19 on the health of healthcare workers and the magnitudes of the mental outcome and associated factors among the healthcare workers. The problem statement provides the healthcare workers are the most susceptible to COVID-19 infection than the general population because of the frequent contacts with infected individuals. They have been required to work in a stressful situation without the sufficient protective equipment. The first part of the literature review is stress, fear, depression, and anxiety. In the United States, among over 20,000 healthcare workers, 53% reported symptoms of at least one illness in the preceding 2 weeks, including depression, anxiety, PTSD, or suicidal ideation. In Colombia, symptoms of stress, anxiety, and depression generally increase in health professionals and also coincide in pointing out that women present more symptoms than men do, due to the high numbers of the women in positions such as nurse or nursing assistant. In mood disorder, which have a high comorbidity with those of anxiety, there is a high prevalence of women compared to men. In China, over 1,000 healthcare workers in 34 hospitals equipped with the fever clinics for the patient with COVID-19 in multiple regions of China reported experiencing symptoms, especially women, nurses, those in Wuhan, and frontline healthcare workers directly engaged in diagnosing, treating, or providing nursing care to the patient with suspect or confirmed COVID-19. The table describes the statistics of this issue of healthcare workers in China. Furthermore, it was found that 40% to 45% of the frontline nurses experience anxiety or depression, with 11% to 14% having some moderate to serious anxiety or depression, especially the transdisciplinary nurse. The most common vocational problems for the transdisciplinary nurse were ambiguous role, transition in operating modes, unfamiliar work contents, and reversal of their daily schedule. Besides that, the medium level staff shows the greater anxiety than the junior and the senior staff. It also found that the illness factors, work factors, time factors, and the safety factors were all related to anxiety and depression. Next, the incidence of anxieties in healthcare workers was 23.04% out of all 230 participants. The incidence of anxiety in female medical staff was higher than that in males. The incidence of anxieties in nurses was higher than that in doctors. The incidence of stress disorder in healthcare workers overall was 27.39%. In Asia, 71.3% of healthcare workers suffer from fears. Among all the psychological distress, fears appears to be the most common psychological reaction amongst the healthcare workers, who continues to provide the healthcare service during the COVID-19 pandemics, followed by burnout, anxiety, depression, and finally stress. More than 2/3 of the healthcare professional reports having the fears amidst the COVID-19 pandemics. Their findings from the previous review in Asia shows that the prevalence of fears amongst the healthcare workers range between 67% and 77.1%.
A series of studies on the sleep problems of healthcare workers during the COVID-19 pandemic have been carried out in many countries. Research found sleep problems could be divided into two types: insomnia and parasomnia. Two groups are most affected: frontline healthcare workers and female healthcare workers. They both suffer from more severe sleep problems than others. The reason behind is lack of adequate protective equipment, which will increase the anxiety of healthcare workers, leading to psychological stress that finally causes sleep problems. Overtime high-intensity workload, isolation, discrimination, and psychological stress caused by long-term exposure to patients are triggers, and sleep problems are symptoms. Also, statistic support in many countries can approve these current issues. For example, in Bahrain, for the frontline healthcare workers, 75% were poor sleepers of 280 people. In Turkey, nurses who are together with the patients for the longest duration with higher PSQI score than other group. And in Holland and mainland China, female healthcare workers report more sleep problems and physical exhaustions than male healthcare workers. So, authorities should do their best to ease the fears of these healthcare workers about COVID-19 by providing what is needed for worker safety on the job. Research found that frontline nurses reported moderate level of burnout. Moreover, many frontline nurses had a moderate, even high emotional exhaustion, depersonalization, and personal accomplishment, respectively. Statistic support shows situation in Asia. Healthcare workers suffer from fear 71.3%, burnout 68.3%, and low resilience 16.1% respectively, ranging from the lowest 58% in China to the highest 19.4% reported in Korea. In Malaysia, the high prevalence of burnout among nurses could be the reduction in their off days, more intense shift hours, and being overworked, coupled with a low salary. Among all the psychological distress, fear appeared to be the most common one, followed by burnout, anxiety, depression, and finally stress. This study used systematic literature review, which includes identification of objectives, selection of papers, and accurate assessment of research to resolve a specified question. Moreover, the data sources are from reliable platforms. The research methods are determined by the relevant keywords or by searching for alternative words. In this review of current publications, healthcare workers in hospitals equipped with fewer clinics or wards for patients with COVID-19 reported experiencing more psychological burden. We also found that there was a high incidence of emotional symptoms in frontline healthcare workers in the COVID-19 outbreak. Several personal and work-related factors, including female gender, working as a resident or nurse, and working in non-COVID designated hospitals, can affect the health and well-being, particularly the mental health of healthcare workers during the pandemic.